Okay, now finally.
Yay!
It was like, you're not live yet. Hi. Hello, everyone. Okay, if you guys can see both of us, please let us know. Give us a thumbs up in the comments. Make
Let
sure
us know if you can hear us too.
yeah, you can see us, make sure you can see our beautiful faces and a blue screen showing our 5 categories for today. Please let us know if you can hear us, and see the screen. Hello. Okay.
Yay!
We are good. Well, hello, Aaron, Crystal, Sylvia. Awesome. Krishana, Amber. Thank you guys for introducing yourselves. All right, guys. So we're going to go ahead and get started. Thank you guys so much for joining us. I am Nurse Sam.
And I am Nurse J or Jer.
Someone said I can hear, but I can't see where everybody else can. But you guys are here to join us for NCLEX Jeopardy, our free webinar. It's going to be about an hour or so. We're going to play our NCLEX style questions. We're going to do so in a fun way. Okay, we know how overwhelming and boring studying for the NCLEX can be. I am a nurse. I've been a nurse for 8 years, so I have been through nursing school. And I remember how it was, especially how it was for studying for the NCLEX. And for me as a visual learner, it was just not as smooth sailing as Instagram makes it seem. So I, had to struggle a little bit. So I definitely relate, and I definitely know how it feels to just be so overwhelmed and have test anxiety and just not be able to just comprehend all the stuff that you're reading, even though you keep reading the same paragraph over and over and over again. So I want to create a fun, safe space for us to be able to come and to come and review for our NCLEX. All right. So I am an LPN, a licensed practical nurse, and I have Jay here who has her BSN, Bachelor's in Registered Nursing. So we are kind of coming at you guys from both sides of nursing. So just in case you guys are feeling like, I'm an LPN, can I come? Or I'm an RN, ASN, or BSN, can I come?
It's everyone for everybody. Everybody can come.
Everyone is welcome, guys. All right. Tiffany, if you can't hear, try refreshing because everybody else can. So try refreshing yours or making sure that your audio is hooked up. All right. Okay. So how we're going to play is, I don't know if you guys ever seen Jeopardy, okay, but the game show Jeopardy. So we're going to, as you guys can see right here, we have our 5 categories, and we have 5 questions per category. Each of those questions are 100 through 500 points. Obviously, the higher the point, the more difficult it is. And how we're going to play is that we're going to pick an answer, pick a question. You guys are going to read through it, and then how we're going to answer is in true Jeopardy style. You're going to say what is, and then the answer. So because this is, NCLEX style, your answers are going to be like 1, 2, 3, 4. You may have select all that applies. So you may have multiple answers. You may have some fill in the blanks. So you're going to have to put what is, and then whatever your answer is going to be. Okay. So how we're going to, and we don't have teams since it's like 300 of us. We don't have teams, so we're just going to kind of play every man for itself. So our teams is going to be our names. All right. So we're going to see who has the correct answer by just going by your name. And if you choose to correctly put what is and then the correct answer. Okay. So if you guys have any questions, please let us know. And if you guys don't, give us a thumbs up so we can know if you want to start. Jay, you have anything to add?
No, just make sure you try your best to participate. There's nothing wrong with getting a question wrong. That's where we find out where we can improve. And if you have any questions about a question, feel free to put it in the chat box so we can kind of talk about it. This is your time to shine, get ready for the NCLEX. Pick our brains. That's what we're here for.
Mm-hmm. Exactly. All right. So somebody said the last category is It's med-surg, and it's just the 500 little point thing that we're covering up. But we'll be able to move our pictures when the answers come up. All right, guys, so we're going to go ahead and get started. I'm seeing some thumbs up. Okay. Quick thing, if you guys do not follow us on social media, please go ahead and add me on social media. All my handles are at The Nurse Sam. You can check me out at thenursesam.com on my website. And then go ahead, Jay, drop your handle.
I will. It's xoxo.jer, Jehr, and I'll put that in the comments.
Mm-hmm. All right. Okay, guys, so we are about to get started. We're going to go ahead and go to our first question. Okay. And just a little tip, if you go ahead and type in what is, and then kind of copy and paste it, that way you can shave off a couple seconds. All right. Little pro tip. I'm telling you, I've been doing this for a little minute. I'm telling you, copy and paste it and then put your answer. All right, guys, let's go ahead and start our first question. Let's do farm for 100. Let's just go ahead and just get there. All right, guys. So there's the question. Go ahead and read the questions. Read through the answer choices. We're going to do it together. And then we're going to go through the rationales as well. Okay.
I wish we had the music playing in the background. That would be so cool. The thinking music.
I know, right? At the same time, we don't want to, we want to like also give them the same minute that they would have as if they would have the NCLEX, if they would be sitting and taking the NCLEX. But I also, me personally, I do like the music, but I know not a lot of people like the music. But we should probably take a poll next time. Do you guys want to try the music in the background or not? All right, so I am getting a bunch of answers. You see this, Jay? I see what is ones and threes. So I see majority is like ones. And remember, this is NCLEX, not NCLEX, this is Jeopardy style. So you have to put what is. Okay, so let's go ahead and see what the correct answer is. All right, so the question reads, an opioid analgesic is administered to a client in labor. The nurse assigned to care for the client ensures that which medication is readily accessible should respiratory depression occur. Is it 1, naloxone, 2, morphine sulfate, 3, betamethasone, or 4, hydromorphone hydrochloride? Let's see what that answer is. You guys are saying 1, naloxone, which is correct. All right, naloxone. Another name for naloxone. Was that the brand name? What's the brand name for naloxone? Just in case. All right, even though at NCLEX they won't have brand names, they'll have only generic names. I recommend that you know both, just because in the real world, a lot of people know based on the brand name because it's easier to say. And then in NCLEX world, you'll always see the generic. So make sure you know both generic and brand names for medications. Little tip. All right, so let's go ahead and move our faces so they can.
How do we do that?
Go to settings, okay. And then where's his webcam thumbnail position? You see yours? Wait, I think I moved it for us.
Never mind. I was like, I don't see that.
All right, so guys, the answer says 1, naloxone. Okay, let's go to our chat to see what you guys are seeing. Yep, Narcan. That's what I was looking for.
I was going to say Narcan.
Narcan. All right, the rationale says opioid analgesics may be prescribed to relieve moderate to severe pain associated with labor. Opioid toxicity can occur and cause respiratory depression. All right, naloxone is an opioid antagonist, which reverses the effects of opioids and is given for respiratory depression. Morphine sulfate, number 2, okay, and hydromorphone hydrochloride. Those are both wrong because those are opioid analgesics, okay? Betamethasone, which is a corticosteroid, that's administered to enhance fetal lung maturity and has nothing to do with that respiratory depression, okay? So 1 is, once again, the correct answer, which is naloxone or Narcan. Someone said, can we screenshot questions and rationales? I'm sure. I don't know. Well, you're going to get the replay. So, all right, guys, great job. So 1 is the correct answer. Once again, you guys are going to get the replay, but I also suggest that you guys just take some notes on the side. If you didn't know it, if If you did versus didn't know it, just take some notes so you can jot some down and refer back to it at a different time. Okay, all right, so let's go to the next question, Jay. It's all on you. Where we going?
Okay. So Sam did 100. Let me top it off with a 200. I'm gonna go with fundamentals for 200.
Fundamentals for 200. Let's go.
Awesome. So I'll give y'all a second to read it, or a minute to read it, and then comment your answers in the chat box.
Now, as you guys are reading the questions, remember to read through it slowly and read through it in your own words. You don't want to rush through the question and miss what it's actually asking, which is a lot of people's problems. We go through it so fast sometimes we miss what the actual point is. All right, so slow and steady, and make sure you're understanding what the question is actually asking. Okay. All right, so we have some answers. Some people have a lot of like, what is ones? What is like high fiber diet? Go ahead and read that question, Jay.
Awesome. So a client states to the home health nurse that she has not had a bowel movement since coming home from the hospital after surgery 4 days ago. The nurse instructs the client to follow which diet at this time? 1, a high fiber diet. 2, a full liquid diet. 3, a low fiber diet. And 4, a low sodium diet.
All right, let's look and see what that answer is. What do you think it is, Jay?
I think it's 1. I'll go with 1.
Oh, it's 1 as well. And looks like we are all correct. Great job. All right, guys. I see majority 1, so that looks like majority of us did get it. Just in case you did not get it, it's perfectly fine. Remember, this is practice. Practice isn't always supposed to be cute, okay? We got to look ugly in practice sometimes. But we know that when the show comes, we're going to be cute, all right? So now let's go back and figure out why this answer was what is 1. I know, right? Go ahead and read through the
rationale. So constipation is the probable cause of the client's lack of bowel movements. Constipation is the difficult or infrequent passage of stools, which are hard and dry. Constipation has numerous causative factors, including psychogenic, lack of physical activity, inadequate intake of food and fiber, and medication influences. A high fiber diet often is indicated for constipation because it will promote bulk and encourage intestinal paralysis. Paralysis, sorry. We don't want paralysis.
Right.
A full liquid diet will add fluids, but no bulk to help relieve the constipation. A low fiber diet has little bulk to assist with the needed peristalsis. Decreasing the amount of sodium in the diet has little, if any, effect on constipation. So definitely a high fiber diet to increase the bulk. And you want to get those bowels moving. And even aside from the NCLEX, that's really important for your patients returning back from surgery. You want to get them up and moving, get them on a high fiber diet so you can get those bowels moving.
And that's really big for client safety. Now, whenever you see constipation, especially when I was in nursing school, whenever I would see it, there would be like certain almost like trigger words and things that I would associate with constipation just because I know what's, associated with it. So you guys know what the definition of constipation is. You guys know kind of how those stools, the characteristics of those stools are hard, dry, infrequent. Make sure you know those causative factors. And right here it says it lists numerous causative factors, including psychogenic. So and a lack of physical activity. So not moving around, especially like after surgery. That's what they say, get up and move about. And then that inadequate intake of food and fiber, dehydration, and then low fiber / low bulk. What I learned was that because I would always get confused whenever I would see bulk and fiber. I'd be like, okay, so is one synonymous? Is one opposite of the other? I would just get super confused. So a trick that I learned is whenever you see fiber, it's really just synonymous with bulk. So if you see something that's high fiber, it's going to have high bulk. If you see something that's low fiber, it's going to have low bulk.
And also, sorry, Sam, go ahead. If you're taking notes, which we highly suggest, I would put to the side, kind of know like what foods are high in fiber, because NCLEX is really big on nutrition. So
Right. Give me an example. Somebody give me an example of a food that is high in fiber. Drop it in the comments. Drop it in the comments. Give us a food or something that is high in fiber, an example. Okay, because just like Jay said, there may be a part 2 to this question to where it says, give me an example of, a high fiber diet. Maybe the question isn't asking for the specific high fiber diet. Maybe it's asking you which of these foods is consistent with your high fiber diet. So you always want to make sure you know what foods is included, just like Jay said. All right, someone said oats, oatmeal, green leafy vegetables, Wheaties. Wheaties is specific. Wheaties, I know for sure. Wheaties.
Yeah, like on the box, it literally says high fiber.
Lentil, whole grain, awesome. Yes. Beans. That's the first thing that popped in my head. When I hear fiber, I think of beans.
I think of apples.
Yeah, in the skin of fruit.
Yeah.
All right, so all those are great examples, guys. So now let's go ahead and go to our next question. Great job, great job. Someone said, what is raisin bran? What is correct? All right, so it's my turn. Let's do med-surg for 200. All right, guys, gonna give you guys some time to read through this question. Remember, read through it slowly at your own pace, but also make sure you are understanding what the question is really asking. All right, so we got 4 answer choices, so this is not select all that applies, so just one answer, and make sure you put what is before your answer, okay? Remember, this is NCLEX Jeopardy. I almost sang the little theme song, The Family Feud. I was about to be really embarrassed. I was really about to go dun 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 dun. All right, so I'm getting like what is 2s, what is 1s? So we're between 1 and 2. All right, let's look and see what that answer is. All right. What is 1? All right, so the question reads, the nurse is teaching a client about the risk factors associated with colorectal cancer. The nurse determines that further teaching is necessary related to colorectal cancer if the client identifies which item as an associated factor. 1, age younger than 50 years. 2, history of colorectal polyps. 3, family history of colorectal cancer. Or 4, chronic inflammatory bowel disease. All right, so that answer was 1, which is the age younger than 50 years. Rationale says colorectal cancer risk factors include age older than 50 years, a family history of disease, colorectal polyps, and chronic inflammatory bowel disease. All right, so let's go into, a lot of people chose 1, which is correct, but all the other people that was choosing 2, 3, I'm wondering if it's because you didn't necessarily gather the fact that the question is asking for the wrong answer. All right, so the key word in this sentence was what, hold on, let's move our head again. The nurse determines that further teaching is necessary. Whenever you see that, whenever you have to, whenever you're determining that further teaching is necessary, it's because the teaching that you just taught, the patient doesn't grasp it. So they just gave you a wrong answer. They said something they shouldn't have said. Basically letting you know that you need to go back and further teach.
Yeah.
So
you're looking, sure you guys, go ahead.
Right. So you're looking for the incorrect answer. So whenever you see that, just so you don't mix up yourself, whenever you're going through the questions like 1, 2, 3, 4, I'll go and say 1, age younger than 50 years. Is that true or false? Because remember, you're looking for the false answer, not the true answer. So just so I don't get like mixed up, I'll just say that in my head. But in this answer, 1 was wrong because it says age younger than 50 years. And the correct answer was age older than 50 years. So we were looking for that wrong answer, which is why number 1 is correct. Make sense?
Slowing down and reading it. I can't name how many times I've missed questions on like practice exams before I took my NCLEX. I took it maybe 3 months ago, and I would miss questions because I would skip over the further teaching part.
Mm-hmm.
So definitely take your time and read what the question is asking, because I get like really anxious and I see an answer, I'm like, yep, that's it, and I miss it just because like I read over that.
Right. Absolutely. Same here. And plus you'll start to get in the habit of, being able to be more aware of those words and those specific questions. When you start to take more and more practice tests, you start to become more aware of those little words in the question like that. That'll make it very easy for you to actually understand what it's asking. Okay. All right. So next question, Jay, it's all on you.
Alrighty, so we're gonna do some mental health for 100.
Ooh.
All right, so I'll give you guys a minute to read the question and the answer, and then we'll go through the rationale.
Mm-hmm. Remember, this is NCLEX Jeopardy, so put what is, just to make it fun. We're having super study fun. All right, so I'm getting lots of what is fours. All right, Jay, you ready?
Yes.
All right, let's see what our answer is. Woo-hoo.
Y'all are killing it. Y'all are killing it.
Like NCLEX.
All right.
Who?
So it is, let's see, Sam, can you scroll up a little bit? I'll read the question.
Oh, yeah.
Okay.
Scroll.
On review of the client's record, the nurse notes that the admission was voluntary. Based on this information, the nurse plans care anticipating which client behavior. 1, fearfulness regarding treatment measures. 2, anger and aggressiveness directed towards others. 3, an understanding of the pathology and symptoms of the diagnosis. And 4, a willingness to participate in the planning of the care and treatment plan. So definitely that is 4. The patient is going to be more willing to participate in the care and the treatment plan if they are admitting themselves versus someone else like putting them there. So in general, clients seek voluntary admission. If the clients seek voluntary admission, the most likely expectation is that the client will participate in the treatment program since he or she is actively seeking help. The remaining options are not characteristic of this type of admission. Fearfulness, anger, and aggressiveness are more characteristic of an involuntary admission. Voluntary admission does not guarantee that a client understands her or his mental health problem, only the client's desire for help.
Mm-hmm. Does that make sense to you guys? Makes sense to me. I would not think that a client that agreed to or that didn't agree to voluntary admission, or a client that is being held involuntary, I just don't think that they're going to be the most compliant, they're going to be pretty pissed. Especially
like, where am I? They're going to be kind of confused depending on the situation.
Right.
So yeah, just know the difference between voluntary and involuntary admissions.
Awesome. All right, guys. Next question. You guys are doing amazing. All right, let's go. And let's do Dosage Calc let's do it for 400 because I'm petty.
Ooh.
No, I know. All right, guys. Now this one is fill in the blank. Okay, so make sure you get your pens, pencils, scrap paper. All right, and go ahead and fill in the blank. Give you guys a minute. or more, because this is math. And we'll go through this. All right, answers.
Awesome.
All right, so this question reads, the primary healthcare provider prescribes hydromorphone 1 milligram intravenously for a client in pain. The medication label states hydromorphone 2 milligrams per 1 milliliter. The nurse should administer how many milliliters to the client? Fill in the blank. All right, guys, so this is a good old question of what's on hand versus what's prescribed. Let's go ahead and see that. All right, so the correct answer is what is 0.5 milliliters. All right, and all right, majority of you guys are getting 0.5 milliliters. Awesome. So the formula for calculating those medication doses is desired over available times volume, right? Yeah, desired over available times volume. The line is mixing me up. So it's D over A times V. And that will equates to your milliliters per dose, or your dosage. All right, so specifically for this one, what we have, okay, we are the primary healthcare provider prescribed 1 milligram of hydromorphone. All right, the medication label states hydromorphone 2 milligrams per 1 milliliter. Okay, so that lets us know that the desired dose of the hydromorphone was 1 milligram. All right, so we're going to put 1 milligram on top. What's available, all right, is that 2 milligrams per 1 milliliter. So that 2 milligrams, we're going to put that on the bottom. And then that 1 milliliter is the volume. So right now we have 1 milligram over 2 milligrams times 1 milliliter. Okay, that's how it's going to be set up. All right, so that 1 milligram and the milligram from the bottom of the 2 milligrams, those milligrams are going to cancel out. Okay, that's going to leave us with just that milliliter. All right, so if you go ahead and do that math, 1 divided by 2 is 0.5 times 1 from the 1 milliliter is 0.5 milliliters. And that's going to be your volume for your medication dose, 0.5 milliliters. Make sense? I hope so, because you guys got it, you know. Desire over half. Awesome job. Awesome. Hold on. Oh, thank you, Alyssa. Doctor's orders over have over volume. Yeah, D over H, have or available, times volume. Great job. All right. All right, Jay, this is all on you.
Awesome. So, let's do pharmacology for 300.
Let's do fun for 3. Ooh. All right.
All right, guys, I'll give you a little time to look at it and put your answers in the chat box.
And this is just one answer choice. No select all or apply yet. Knock on wood. Wait, let me get my chart. Okay, I'm back. All right. Getting our answers. I see a lot of what is 2s. What do you think, Jay?
Yeah.
Let's go.
I think it's 2.
Let's go and see what it is. And what is 2? NCLEX who? Like, NCLEX needs to run and hide from you guys at this point, because
right,
you're scary.
Y'all are killing it.
Right.
So Insulin in unopened vial should be stored under refrigeration until needed. Vials should not be frozen. When stored unopened under refrigeration, insulin can be used up to the expiration date on the vial. Options 1, 3, and 4 are incorrect. So you never freeze the insulin.
Mhm.
You want to make sure you refrigerate it. Do not store it in a dark, dry place. Make sure it's like a kind of well lit area, like
Well,
refrigerator. And then do not keep it at room temperature. You want to keep it in a cool area. Also, don't keep it in your car. Make sure you're educating your patients, especially if they've never used insulin before. Educate them on insulin storage because health illiteracy is real, and sometimes they just don't know. And you don't want to put that patient at risk, or you don't want them to put themselves at risk for hypo or hyperglycemia due to improper storage of their insulin. Also, make sure that they are checking their expiration dates that are on the vials and getting those replaced as needed.
mhm. And also, I always say look at the answer choices, and sometimes the answer choices will also give you like a little hint just in case you don't know what's going on. Sometimes the answer choices will help you. For example, in this particular example, one if you didn't know that there was something specific about how to handle insulin, or you didn't know exactly where this question was going for, just look at the answer choices. 3 out of 4 of them have to do with the temperature in which you store the insulin. 1 says to freeze it, 2 says refrigerate it, 3 says room temperature. You can't freeze, refrigerate, and room temperature,ize, your insulin. So
Mhm.
usually when you have answer choices and it's like the opposite of another, you know that's going to be one of those. 3 is the only one that's showing it in it doesn't have to do with the temperature, but it has to do with still have to do with how to store it, obviously. But because it's saying store in a dark, dry place, it has to be a well-lit place. 3 is out. So that's how just a little pointing that out, just in case you guys didn't notice that 1, 2, and 4 all had something to do with the temperature. And so that should have raised some red flags that we keep seeing on Instagram, that there was something with the with the insulin and the temperature of the storage. All right. Good job, guys. Next one. Let's do mental health because the pandemic has just got us.
Oh, for mental health.
Right. All right, guys, let's do mental health for 400. You guys know the drill. What is? Read the question slowly. All right, so don't skip over any crucial keywords. Give you guys a couple seconds here. Give you guys about a minute, and then we're going to go through it. All right. I'm seeing 4s and 2s. Honestly, I'm seeing like a healthy mix of 4s and 2s. I see like a 3. All right, so let's go ahead and read this. The nurse is caring for a female client who was admitted to the mental health unit recently for anorexia nervosa. The nurse enters the client's room and notes that the client is engaged in rigorous push-ups. Which nursing action is most appropriate? 1, interrupt the client and weigh her immediately. 2, interrupt the client and offer to take her for a walk. 3, allow the client to complete her exercise program. 4, tell the client that she's not allowed to exercise rigorously. I can speak. All right, let's look and see what that answer is. And it is what is 2, interrupt the client and offer to take her for a walk. Now let's try to figure out why it was 2. All right, so clients with anorexia nervosa frequently are preoccupied with rigorous exercise and push themselves beyond normal limits to work off caloric intake. The nurse must provide for appropriate exercises and place limits on rigorous activities. All right. The correct option stops the harmful behavior, yet provides the client with an activity to decrease the anxiety that is not harmful. So that's why she interrupted the client from her harmful rigorous activity, but still offered to take her for a walk, because once again, you know that with anorexia, they are preoccupied with trying to work off that caloric intake. So instead of just interrupting her and stopping and saying, hey, and disregarding her feelings and that anxiety, still offer her an option to still decrease that anxiety and try to work off that caloric intake, but just in a healthier way. It says weighing the client immediately reinforces the client's preoccupation. Wow, I could not say that word. Weighing the client immediately reinforces the client's preoccupation with weight. Allowing the client to complete the exercise program can be harmful to the client, and telling the client that she is not allowed to complete the exercise program will increase the client's anxiety. All right, so it's very important to make sure that the client with anorexia nervosa is still being, you're not disregarding her, his or her feelings, but still making sure that they're doing their behaviors is in as safe a way as possible. Somebody said, yeah, makes sense. Perfect. All right, you guys are doing awesome. All right, Jay, let's go now. Ball's in your court. Where we going? Where we going?
Let's see. Let's go for dosage. We'll do 200.
Hold on. So somebody said, Nancy said, but this is when I question myself if she's anorexia nervosa. She can't be walking. Why can't she walk? Yeah, answer that question, Nancy, and let me know why walking disqualifies her from being anorexic. Okay, go ahead. Which one did you say, Jay?
Dosage for 200.
Dosage for 200. 200. Ooh-wee. Okay.
Righty.
Let's.
That was loud. A primary health care. Okay, never mind. I'm not going to read it first. Sorry, y'all. Go ahead and read it and then put your answers in the chat box.
Well, I feel like for these, we can read it together because we have to work it out anyway. So we might as well just all read it, you know? So you can read through this one.
Awesome. Okay. A primary health care provider's prescription reads ampicillin sodium 125 milligrams IV every 6 hours. The medication label reads, when reconstituted with 7.4 milliliters of bacteriostatic water, the final concentration is 1 gram per 7.4 milliliters. The nurse prepares to draw up how many milliliters to administer one dose. 1, 1.1 milliliters. 2, 0.54 milliliters. 3, 7.425 milliliters. And 4, 0.925 milliliters.
Everyone's saying 4. Now, are y'all really getting 4? Are we at the point where everyone's like, everyone says 4, so let me just put it 2. All right. Jay, what do you think it is?
I think it's 4.
I think it's 4. I think it's 4 because majority of y'all said it's 4, and I didn't get a chance to work it out. I hope y'all are right. Now, if you're wrong, it's on all y'all. Okay, we right. What is 4? Good. All right, guys.
All right. So you're going to convert 1 gram to milligrams. So in 1 gram, there's 1,000 milligrams. In the metric system, to convert larger to smaller, you're going to multiply by 1,000 or move the decimal point 3 places to the right. 1 gram is equal 1,000 milligrams.
That was a horrible explanation. Sorry.
I know. I was like,
where's the rest? Hold on.
I use dosage calculations to set these type of problems up.
I know, right? Yeah,
so you want to ask yourself what you're looking for. You're looking for milliliters. And so then I typically would put milliliters is equal to, then I look in the question to see if I can find anything that matches that. Yes, there's 7.4 milliliters over 1 gram. And so we're going to have to convert that. We'll put
it's my fault. The second part of it showing the actual math didn't make the cut. So I'm gonna show y'all how to do that. While you continue, I'm gonna just write it out.
Okay. So we got our 7.4 milliliters over 1 gram. And then we have 1 gram is equal to 1,000 milligrams. That's our conversion. And then we have 125 milligrams to cancel out that other milligram. So you should be left with milliliters at the end after you cancel everything out, and then divide. You're going to multiply across and then divide, and you should end up with your answers in milliliters. And trusting y'all is 0.925. What you get, fam?
0.925.
Ooh, y'all don't even need us.
I'm gonna show y'all. I just want, like, we got the correct answer. I just want to make sure everyone got there the right way. And hold on, thank you, Gigi. I'm gonna show you kind of in. Okay, so that equals. Okay. Oh, hell. I just realized it's went backwards. But the way Gigi did it, she explained it here, and Teria did it. So basically the way I'm going to verbalize how we wrote it out as far as how to convert. So yes, you want to convert 1 gram to milligrams. And, to convert grams to milligrams, you got to 1 gram is equal to 1,000 milligrams. So we have 125 milligrams that we're starting off with. And once again, you want to change that from milligrams to grams, because the final concentration is 1 gram over 7.4 milliliters. So they're giving us availability in milligrams, so we have to make sure that they match. So you want to convert the milligrams to grams, and you do that by dividing by 1,000. So 125 divided by 1,000 is going to take you to 0.125. All right. And that 0.125, we're going to multiply that by the volume, which is 7.4. Okay. And that's going to give us our final concentration to administer that 1 dose. That 7.4 times that 0.125 is going to equal 0.925. Okay. So it's basically dimensional analysis. You want to convert the milligrams to grams, because once again, the concentration right here is 1 gram over 7.4 milliliters. So you just want to make sure that everything matches, grams to grams, milliliters to milliliters. Okay. So after we convert that milligrams to regular grams, we're just going to multiply that by the volume to get us the actual volume of our 1 dose. All right. Awesome job. Thank you to Teria and Gigi for actually typing that out, because this is backwards. All right, great job.
There are several ways to answer these questions. So if you have a certain way that you answer your dosage calculations, then go for it with your formula. You don't have to switch it up. The answer should always be the same, regardless. of
Mhm.
which approach to use.
Exactly. Is it you or me? I think it's
It's
me.
your turn.
Me, guys. All right, let's do farm for 400. I mean, fundamentals for 400. All right. Ooh, cold, moist compresses. All right, guys. This one's just a little small little couple sentences. So I'm just go ahead and read this one with you guys. A cold, moist compress is prescribed to be applied to the client's right knee. Which should the nurse plan for? 1, leave the compress on for 45 minutes. 2, ensure that the compress material is sterile. 3, ensure that the temperature of the compress is 15 degrees Celsius or 59 degrees Fahrenheit. Or 4, expect some bluish discoloration of the skin during the application period. All right, we are trying to figure out what is that correct answer, okay? Remember to really answer what the question is asking, all right? What should the nurse plan for in regarding to this cold, moist compress being applied to the client's right knee? All right, so I'm getting like 3s and 4s, so let's go ahead and see what that answer is. And it is 3. Ensure that the temperature of the compress is 15 degrees Celsius or 59 degrees Fahrenheit. All right. The procedure for applying cold, moist compresses is the same as that for warm compresses. All right. The cold compress is applied for 20 minutes at a temperature of 15 degrees Celsius or 59 degrees Fahrenheit to relieve inflammation and swelling. Clean or sterile compresses can be used, although sterile may be prescribed for open wounds. When using cold compresses, the nurse needs to observe for adverse reactions such as burning, numbness, or mottling of the skin, redness, extreme paleness, and that bluish skin discoloration. All right. If these adverse reactions occur, then the compress must be immediately removed. Okay. So let's look and see. Erin said, I thought I said blush. Fair. Fair point. Because then it goes from bluish to blush and it's a red rose. That's fair. I never thought about that. That's actually pretty funny. But yes, great job, guys. It is 3. You want to ensure that the temperature of that compress is 15 degrees Celsius. Okay. All right. Next question. All right, Jace, all you.
Woohoo! We are clearing the board.
Mm-hmm.
Let me turn it up a notch. We go with pharmacology for 500.
Woo!
No.
Spicy today. I'm just kidding.
No. Some flames over here.
All
Okay.
right.
So it's a short one, so I'll read this with you guys. The nurse has given a client the prescribed dose of intravenous hydralazine. The nurse evaluates the effectiveness of the medication by monitoring which client parameter? The pulse rate, the urine output, blood pressure, or the potassium level?
Oh, everyone just said that one.
What
Everyone's just pretty much just going.
are we getting?
Everyone's saying 3, which is blood pressure. Like before you even finished reading it, everyone's like, "Oh, girl, 3, blood pressure,
Yeah.
blood
3.
pressure."
Awesome.
And it is what is low key. I was like, "Please let me."
Awesome. So hydralazine is an antihypertensive medication. It is used in the management of moderate to severe hypertension. It is a vasodilator medication that decreases the afterload, and the blood pressure needs to be monitored. The remaining options are unrelated to this medication. So these are one of those questions where you have to know what the med is to be able to answer that question. So again, hydralazine is an antihypertensive medication. So you're going to monitor their blood pressure. If it was a pulse rate, it would be like a what is it, beta blocker. If it was 2, it would probably be like something like furosemide, a diuretic. And then, of course, like with potassium, anything that's going to increase or decrease the potassium, or it could be a diuretic as well. But definitely 3. So you just have to know that medication to be able to answer that question.
And just because this is, our NCLEX review and stuff like that, like this is, let's go ahead and review the type of medication that this is, so that just in case you get this question during the actual NCLEX, you get it again, we've already done this part. So just like what you said, as far as when it comes to pharmacology or these types of questions, it's very important that you know just about that medication. And it's like, when it comes to pharma, it's like you either do or you don't know that medication. There's really kind of no in between. And the only way to, continue to really, well, the best way I think to practice pharmacology is repetition. And you just got to get out there and really go by class. But as far as hydralazine, the specific class of medication, the type of anti-hypertensive medication this is a vasodilator. So it works by relaxing the blood vessels. So that's why blood pressure is going to be specifically affected by this medication, that parameter. Now, if it was pulse rate, the type of medication, it would be like digitalis or digoxin. That would be a medication to which they have to monitor the pulse rate, because it's affecting not the blood vessels, but it's actually affecting the electricity in the heart. Like you said, urine output, that would be like a diuretic, something that affects the kidneys and the heart. So something like a diuretic. And I would probably say potassium level too, with that diuretic, like a potassium sparing. But because that hydralazine is specifically for, like I said, those vasodilator medications, blood pressure is going to be the parameter. That's how I got to it, as far as via class, working on it via class. If that makes sense to you guys. Is that how you study as well for pharmacology? How would you, is there like a specific study tip, or can you just give us one study tip of how you recommend studying for pharm? Like, if we get questions.
Definitely knowing your suffixes, that helps me a lot. Like for like the beta blockers, OLOL, the hydralazine, like the zine, just different suffixes help me to categorize that. And of course, like knowing the classifications of the drugs. Also, like in each classification, like knowing a certain drug that will stick out the most, that's what NCLEX will tend to test on, like something that's just like out of the ordinary, or just a very common medication, hydralazine, furosemide, stuff like that, they will typically test you on. Also, like I said, knowing the indications for the drugs, and that way you can think about like your nursing considerations. And it's not just for like NCLEX, it's for the real world too. So if you're giving a patient hydralazine, you check their blood pressure and they're riding, like, say, in the 90s systolic and let's say 60s diastolic, you want to use your clinical judgment to maybe hold that medication so it won't decrease their blood pressure anymore and cause them to bottom out. So when you're taking the NCLEX, you'll think about different things like that. So they may not give you, a straightforward answer like this. Sometimes you will have to know what the drug is, the indications, and like contraindications for that drug. You'll have to be able to think about that stuff. But just knowing what it is or being able to recognize it, you'll be able to answer it. And sometimes the process of elimination helped me with these questions. If I don't recognize a drug, there's no way you can learn every single drug. There's just no way. So sometimes I recognize other things. If I look at pulse rate, I'll be like, no, I think something like digoxin or your beta blockers, and I'll kind of cancel that out. And then think of potassium, like, no, not so much. So you kind of use a process of elimination with those questions if you don't recognize the drug.
Gigi said some patients won't take their BP meds if you don't take their BP. I mean, that's how it should be, because you know, with another thing with medications, I would see this all the time as far as like for contraindication, whenever it says for contraindication, unless it's something to where it's like you said, something that stands out, the contraindication is always like, don't take if you're allergic to this medication. Like, duh, you know. So this little small things like that, like you said, that they won't test you on like this, like the minutia. They're not going to test you on that. They're going to test you on the actual things that are supposed to stand out, the common things that nurses actually you know, will go through. Like Gigi just said, some patients won't take their BP meds if you don't take their BP first. That's a client safety thing. That's a perfect NCLEX question, you know, just because that's a, you know, safety thing right there. The questions that the NCLEX will ask you will be more so about safety than, hey, do you remember
what this drug is?
Right. Do you remember all the side effects of this? You know, it has to be something specific towards the life or death of a patient. So kind of let that help you to where you don't feel like you have to learn every medication, because you won't. So just get that out your head now and just use that as a way for you to find ways that help you study specifically for pharmacology, because it is such a large content topic. Find little ways and loopholes to remember that stick for you in your study style. So that's my advice. All right, let's go to our next one. Yep. All right, let's do MedSurg for 500. All right. I'm gonna let you guys kind of read through this. And this is select all that apply. I'm so sorry. I do love you though. It's all the love. Now with select all that apply, you guys know that it can be as little as one of the answer choices or as many as literally all. So in this question, we have 5 answer choices. So the correct answer can be just one of those answer choices, or it can be literally all 5. So that's the blessing and curse of select all that apply. So you want to make sure that your answer, you answer it in totality. They don't give partial credit for select all that apply. So if it's 1, 2, and 3, and you only put 1, 2, you're gonna get it wrong. So we just got to make sure that we're really reading the question and selecting all that apply. All right, so I am getting majority 3s and 5s, which is deep rapid breathing. First, let me read the question. All right, it says a client with a diagnosis of diabetic ketoacidosis, or DKA, is being treated in the emergency department. Which findings support this diagnosis? Select all that apply. All right, 1 is increase in pH. 2 is a comatose state. 3, deep rapid breathing. 4, decreased urine output. Or 5, elevated blood glucose level. All right, so DKA to it. So we know what DKA, that's, I already know 5 is going to be it because elevated blood glucose. But the correct answer is 2, 3, and 5. 2, which is the comatose state. 3, a deep rapid breathing. And then 5, elevated blood glucose level. All right. Okay, so let's look at what you guys are saying. Let me see if anybody got 2, 3, and 5. Sylphie got 2, 3, 5. Great job. Joanna, awesome job. But yeah, like I said, it has to be all the correct answers in order for it to actually count as being correct. And in this particular case, about 2 of you guys got it. If you didn't get it, that's okay. Don't Don't worry about it. Okay, that's why we're practicing. Okay, congrats and great job to the two of you that did get it. Now, let's go ahead and break it down so we can figure out why. So if we get this question again, we all gonna get it right, okay? All right, so because of the profound deficiency of insulin associated with DKA. Now, DKA, once again, diabetic ketoacidosis. In DKA, glucose cannot be used for energy, and the body breaks down fat as a secondary source of energy. The ketones, which are acid byproducts of fat metabolism, that starts to build up. Okay, and then the client experiences a metabolic disturbance called metabolic ketoacidosis. All right, high serum glucose that contributes to the osmotic diuresis. All right, and the client becomes severely dehydrated. So with DKA, you have excessive urination. All right, and that's why, and that's from the super high glucose. All right, and because of the metabolic ketoacidosis, if that's left untreated, the client can become comatose because of that severe dehydration, because of that acidity in their pH, and because of the electrolyte imbalance. So that deep, rapid breathing that we were talking about before, number 3, that's called Kussmaul's respirations. All right, that's specific, and that's specific to DKA. Whenever you kind of hear DKA, Kussmaul's respirations is a part of the characteristics being described. Okay, that's a deep, rapid breathing. Once again, that's associated specifically with DKA, and it's actually a compensatory mechanism by the body. All right, it's attempting to correct that acidotic state by blowing off extra carbon dioxide, which is an acid. So in the absence of that insulin, the client's going to experience severe very high blood glucose, okay, hyperglycemia. And like we said, the higher that blood glucose, the more they diurese and the more dehydrated they get, okay? This says option 1 is incorrect because in acidosis, the pH would be low, not high. Option 4 is incorrect because a high serum glucose will result in, once again, in that osmotic diuresis, which actually will result in a higher urine output, not a lower urine output. Okay. All right. Thank you so much, Nancy. Good to have you. You'll still be able to get the replay. All right. So did that make sense, guys? That was actually really good. That was a good learning.
Yeah,
DK,
really
that
good
was really good.
Also know that DKA is typically associated with the type 1 diabetes. So make sure that's a good highlight to put, like if you're taking notes, make sure you know that it's associated with your type 1. And then the opposite of that is your HINKS. Is it hyperosmolar?
Yeah.
Something.
Yeah. Now I'm going to
hyperosmolar. I can't remember the rest
of it. I know exactly what you're talking about. And I would just literally just say hyperosmolar and know what I'm talking about and just skip it.
Yeah.
Hyperosmolar hyperglycemic state.
Okay, that's what it is. Make sure you know that that's like literally the exact opposite. This is typically seen in your pediatric patients, but it can happen in adult patients. This will likely present like in the ICU critical care unit, but this could happen to any one of our patients, no matter where you are as a student nurse and as a nurse. So be able to recognize those signs and symptoms because this is deadly. This patient is in an acidotic state. So, yeah, just a few tips with that. Just take notes.
Another little tip, just based off of the origins of DKA and type 1 diabetics. Question, would you most likely see more cases of DKA in a, I'm gonna not say that. Okay, let me just say what I was going to say and answer the question. So, with type 1 diabetes, you're going to find that mostly in your juvenile patients. So in your, especially in your pediatric patients, because a lot of times it's diagnosed when they're young. So a lot of times that type 1 diabetes, it's not really, I don't know if you see this when you go to clinicals, but whenever I went to clinicals at Grady, I saw it a lot. All the DKA patients I saw were like under 18, and it would be usually that would be their first introduction into them understanding or realizing that they have type 1 diabetes, because usually because they're so young, they don't know it's a problem unless it's so high that they're in that DKA. And my clinical instructor said that there was like a small trend between, pediatric cases. Well, there's a link between the pediatric cases and DKA, just because of the fact that DKA is found in type 1 diabetics, which is majority diagnosed when you're in your childhood. So would you say you kind of like agree, or would you say you kind of see something different, both personally and at clinicals? What would you say?
Yeah, I agree with that. It is more profound in our adolescent patients.
Mm-hmm.
I've never seen it like in clinical as a nursing student, but our professor did stress the same thing that you went over.
Yeah,
But I
stress
did see it
type 1.
yeah, she talked about all of that stuff, and I did see it. I didn't see it in a pediatric patient. I saw it in an adult, but I know
Mm-hmm.
like they say, most times our pediatric patients don't find out that they have the type 1 diabetes until they're in that state, which is a great opportunity to think about your nursing interventions, especially education, because that's what NCLEX is all about. So
All
you have some considerations that you're thinking about, such as how to basically help that pediatric patient adhere to the medication regimen, because they want to be most of all of their years. So you
exactly.
want to really start critically thinking when it comes to situations like that, thinking outside the box, because
Right.
that's what NCLEX is about.
And that's basically the takeaway that I wanted you guys to get from it. Just we started off with DKA and somebody type 1, but then that extra level of thinking that's required of you both as a nursing student, as a future nurse, but it's required of you to take that thinking as an extra step further. If we're talking about DKA and type 1 diabetics, take that extra step and think, okay, so I know type 1 diabetics are majority children that are diagnosed for type 1 diabetics. And I know and then take it another step further, if I know I have an adolescent that's having this life-changing, DKA, getting diagnosed with type 1 diabetes, what's the type of, mood they're going to be in? What's the type of, mental state that they're going to be in? What can I do as a nurse and as their advocate to make sure that they don't feel like their life is over, B, they feel like they can manage this disease, and C, they also feel like that, their fears are being heard and validated. So those are the type of questions and responses that NCLEX is going to expect from you. So I don't know why I just did that.
Understand.
Understand. But yeah, that's the type of responses NCLEX is going to expect from you. So just wanted to put that in the atmosphere now so you can start trying to think along those lines. All right. That was a mouthful, not bad. But I really wanted you guys to take that away from that specific question, because it's just how easy you get that one question, it can be spun into 10 different ones. Mm-hmm. All right, so let's go ahead and go to our next question. I don't even remember who was on that question. That was me.
So I'm going to go with fundamentals for 100.
Whoop.
Okay. So the nurse is planning care for a military veteran. Should prioritize nursing interventions targeted at managing which condition, if present, that commonly occurs in this population? 1, hypertension. 2, hyperlipidemia. 3, substance abuse disorder. Or 4, post-traumatic stress disorder. I feel like this was a question that like we all were like kind of reading and we saw like
Yep.
the first part of it and
Yep.
we're like, yeah, you know what it
Yep.
is.
That is the perfect example of how like sometimes that can work against us. We'll just see a specific part of the word. We're like, oh, post-traumatic. It was like, oh, military, PTSD. That's exactly kind of, you know, where you go in your head. And that's honestly how like you're supposed to, that's how you retain, that's how you recall things, by associating with, you know, the only reason why everyone went instantly to PTSD number 4 when they saw military veterans, just because of how much PTSD is associated with being in the military outside in the regular society, entertainment, movies, TV. It's just everything that we are taking in somehow gives us that answer, that PTSD and military veteran just kind of go hand in hand. And even in this question, before we even got to apply our nursing, our nursing judgment, our nursing comprehension, it was just like, oh, well, I kind of knew that just from knowing it.
Exactly. So you want to show the rationale for that?
I know. Now, what if we did all that and the answer was like hyperlipidemia?
I know. I'd leave for a second and then come back. So post-traumatic stress disorder is extremely common in this population. Identifying and treating mental health disorders assists in mitigating, is it magitating, whatever that word is.
Oh yes, everyone's getting the replay, so if you can't stay for the whole thing, it's perfectly fine. You will get the whole replay tomorrow morning.
Suicidal risk. Treatment of comorbid conditions such as PTSD may also address any substance disorder. Use of screening tools in identifying substance use disorder is helpful. Treatment of PTSD includes exposure therapy, psychotherapy, and family group therapy. Hypertension and hyperlipidemia are also important, but not the priority. The risk of suicide and other safety concerns associated with PTSD are the priority for this population. So yeah, definitely. So it is important to know like what populations are at risk for what comorbidities, but you also don't want to just assume and things like that, but also like know your high risk population, like African Americans are at high risk for hypertension. So you just want to know like what populations are at risk for what and how to better educate or find like resources for that population. But I think this one was like an easy peasy, and you will have like a few easy questions on your NCLEX. They're just like, boom, it's right there. But definitely think about some of your signs and symptoms of PTSD. They kind of relive the moment over and over again. So know those hallmarks of those disorders, and you'll be able to get those questions right.
Yeah, for those easy peasy questions, whenever you see those, you know, come over, you're just like, oh, thank you, Jesus. Thank you. I needed this for sure one. Like it'll be like a super simple question, like snow can be found in winter. No, I'm just kidding. But yeah, like you said, there's levels to all the questions, obviously. And like you said, this one was one of the lower difficulty ones. I won't say easy. Lower difficulty ones. So great job, everybody. Let's go ahead and go to our next question. Let's go and do Dosage Calc for 100 since we're struggling with this one. All right, so all right, guys, this is fill in the blanks. So go ahead and get those Scrap papers out. The nurse is completing a time tape for a 1,000 milliliter intravenous or IV bag that is scheduled to infuse over 8 hours. The nurse has just placed the 1100 marking at the 500 milliliter level. The nurse would place the mark for 1200 o'clock at which numerical level or milliliter on the time tape? Fill in the blank milliliters. All right, so I'm gonna read that again because I was kind of confused. All right, so we have a time tape. So we have 1,000 milliliter bag scheduled to infuse over 8 hours. So what's that, like 125 milliliters? What's 1,000 minus 8? I'm gonna divide it by 8. Is it 1250? Actually, hold on. Now it's gonna bother me. Yeah, I was right, 125. Okay, so the nurse has just placed the 1100 marking at the 500 milliliter level. So that means at 1100 hours, it was 500 milliliters. So 500 milliliters had infused at 1100 o'clock hours. The nurse would place the mark for 1200 hours, which is just 1 hour past that, at which numerical level on the time tape. All right, fill in that blank. All right, so you guys are, I'm seeing 625. Let's look. And that's what it's actually 325. Oh yeah, you guys didn't subtract it, you added it. All right, so it's 325. If the IV is scheduled to run over 8 hours, the hourly rate is 125. And that's why we were looking at 1,000 milliliters scheduled to infuse over 8 hours. So we know that's 125 milliliters per hour. So remember, the nurse just placed the 11 o'clock marking at the 500 milliliter point. So that gives us our reference point. So the next hourly marking would be at 375 because an hour passed between 11 and 12. So another 125 milliliters infused. So it'll be 500 minus the 125, not 500 plus 125. So that's why it gave us actually it wouldn't be 375, it's 325. I meant 375 would be 375. This is wrong. This is incorrect. It's actually this one. So 375 is actually the answer. Just like it says right here, I just wrote 775. All right, let me look and see. Oh, y'all got it? Okay. Yep. So yes, we subtract that 125 from the 500 instead of adding. So it's 375. Great job, Gigi. Is that the one person I got it? Yep. All right. Awesome job. That was a good one. Because even I was like, because it went from the 11 o'clock to 12 o'clock. We were like, oh, an extra hour. But no, it's an extra hour that the IV infused. So it shouldn't have grown in numerical level. But, you know, that's just an example of how we got to read the question. All right.
This part.
All right. I even got. All right. Your turn.
All righty. Let's go for med surge for 400. Okay. So the nurse is analyzing the laboratory results of a client with leukemia who has received a regimen of chemotherapy. Which laboratory value would the nurse specifically note as a result of the massive cell destruction that occurred from the chemotherapy? 1, anemia. 2, decreased platelets. 3, increased uric acid levels. Or 4, decreased leukocyte counts.
Let's see what it is. What is
an increase in uric acid level, hyperuricemia, is especially common following treatment for leukemias and lymphomas because chemotherapy results in a massive cell kill. Although options 1, 2, and 4 may be noted, and an increased uric acid level is related specifically to cell destruction.
Yay, Teria! All right, so what is it? A lot of people chose
4, I believe. Was it
a lot
4?
of people chose 4, which was decreased leukocyte count.
Yeah, so that would be, I would say that would be more of like the cancer itself without the chemotherapy. And then once they add chemotherapy, then they're more prone to that increase in uric acid level.
Gotcha. Ooh, that was a good one.
Mm-hmm.
That was a good one.
I knew that that's one of those tricky ones where it'll try to throw you off. But definitely know that when they're taking like any type of chemotherapy in their body, they're more prone to an increased uric acid level. It's going to affect their uric acid before it would do, well, yeah, chemotherapy would affect the uric acid level, and the cancer itself would affect the leukocyte
count. Wow, that's a good one.
They're specifically talking about the chemotherapy.
That's a good one.
As a result from the chemotherapy, read the stem of the question,
yes.
What they're asking for. Now, if they said as a result from the leukemia, then we'd probably choose leukocyte count.
See, that's a perfect example of words mean things. Wow, that was a really good one. That was a perfect example of how NCLEX be trying to come for your life. Okay, you go just confident it was number 4. But that was a really good example of how once again repetition. Like I wouldn't have known this question unless we would have come across it in one of our practice tests. Like that's one of those things that you probably missed. I definitely missed during that I just don't recall from lecture, but from doing these questions and doing these practice questions repetitiously, you come across information that you probably wouldn't have uncovered if you were just going through your textbook. So that's why, doing these practice exams and doing these NCLEX Jeopardies, it's not just because we want to have fun and we want to, be in your face for 2 hours and stuff, but we really want it to help you guys. And we know that it can and will help you because you're just exposing yourself to more information for free. Why not?
And just a side note, we won't go through this, but if you're taking notes, like we highly suggest, I would put a side note to know like your precautions for patients that have like cancer that are on chemotherapy. And know that chemotherapy is a strong vesicant, so be considerate of that. Try to just think of little things to throw at you. But yeah, I would take little notes of that, like knowing your precautions, knowing that anytime a patient is taking, it's on like chemotherapy, it's a strong vesicant.
And they can't have like fresh veggies and flowers, fruits, sushi.
Yeah.
Sushi is pregnancy.
Is there? I think they can't have that either because it's like raw.
Yeah. Yeah. So I was like, I think it's them too. But I remember whenever I would see chemotherapy, for some reason, I guess during the year of my test, chemotherapy, and I would always just see like no fruits, vegetables, and flowers. For some reason, I would just always see those.
And then their room would be like I think it's the positive one where you want to keep, how the with TB it's like the negative pressure room.
Oh, like the negative pressure room?
Yeah. So this one would be the positive pressure for your patients that are on chemotherapy. Any like oncology patient, I think it would be like the positive room. So you would want to know that, like your precautions for that.
Awesome. Yeah, metallic taste. But yeah, you see how many questions we just like spit at you guys from this one question that we just got finished with three minutes ago? NCLEX, ladies and gentlemen. This is what they do.
Know it all. Know it all.
Right. All right. Was it me or you? I forgot.
You.
Okay.
I just did.
Let's do mental health for 3. All right. This one's short, so I'm going to read this with you guys. All right. The nurse is planning activities for a client diagnosed with bipolar disorder with aggressive social behavior. Which activity would be most appropriate for this client? 1, chess. 2, writing. 3, board games. 4, group exercise. Okay, so we have, let's go back to the question. We have a client diagnosed with bipolar disorder with aggressive social behavior. So if they are behaving aggressively socially, I'm just not gonna, that's gonna help me think, as far as activities, both socially and independently. So let's go ahead and kind of see what that is going to do. And that's gonna give us answers number 2. Solitary activities. Once again, if the patient is exhibiting aggression, if they're in a social environment, then removing them from that social environment or having them do activities that aren't as social would be the most appropriate thing. So this rationale says solitary activities that require a short attention span with mild physical exertion are the most appropriate activities for a client who is exhibiting aggressive behavior. Writing or journaling, walks with staff, and finger painting are activities that minimize stimuli and provide a constructive release for tension. The remaining options have a competitive element to them or are just group activities and should be avoided because they can stimulate the aggression and increase psychomotor activity. And that's not what you want in a patient with this diagnosis. Okay, so once again, 1, chess, that has a bit of a, well, not a bit, it's definitely very competitive. So, you don't want the patient to go crazy when you say checkmate, you don't want an outburst. So 1's not there. 2, writing, that was the answer. That's journaling and also something that's done in solitude. Board games, once again, that is a competitive aspect to it. Like in my mind, I instantly went to Monopoly. I'm like, that person cannot play Monopoly. And then like Park Place, And then number 4, group exercise. This one can stimulate aggression. I just think about the stimuli, and because it's a group and they're not socially behaving appropriately, anything group wouldn't be the best right now. So that's why number 2 is the most appropriate answer. You see how they say most appropriate in there? It's not just right or wrong. It's what's most appropriate for this client and what they're going through situationally. Okay, so it's not always black and white. But great job, guys. What is 2? A lot of you guys chose that. Perfect.
Yeah. And know that this patient, if you're taking your notes, make sure you put to the side when it comes to like bipolar disorder, they have that manic or depressive phase. So this patient is likely in the manic phase. So that's when you really want to consider things like solitude activities or solitary activities versus like when they're in the depressive phase, it would likely be the opposite. So just know like what phase they're in when it comes to the bipolar disorder.
Yeah. The bipolar is when you have like really high highs and like really low lows. Yeah. Great job, guys. Someone said that's how they get you. All right. That was a good one. All right.
Alrighty. I'm going to do farm for 400. Okay. A client is due for a dose of pumidine, whatever. Right. Okay.
You need some.
The nurse should temporarily withhold the dose and notify the primary healthcare provider if which laboratory result is noted. So a sodium level of 137, chloride level of 106, potassium level of 2.5, or magnesium level of 2.1.
Okay. It's funny because like you can get this answer this question from two different routes. It's like, even do you know what bumetanide is and
Yes.
just kind of know, or do you just look at these laboratory values and look for one that's just so off that you have to notify?
Yes, that's what I was like. You can answer it either from the actual options or
Right.
knowing what that is. So I'm gonna reveal the rationale. What are we getting?
What is
3.
the
We got a 4-2.
level?
Okay. So bumetanide is a loop diuretic that is not potassium retaining. So it's not a potassium sparing. The value given for potassium is below the therapeutic range of 3.5 to 5 for this electrolyte. The nurse should notify the PHCP before giving the dose so that potassium supplementation may be prescribed. The results listed in the remaining options identify normal values. So just knowing your normals will definitely help you answer this question. And for sure, a lot of questions on NCLEX, you'll see a lot of values, and you just have to know what's normal and what's abnormal. So yeah, you have your sodium, which is pretty much in the normal range.
Let's go through it. Let's go through. I love these types. Whenever we get lab questions, I'm always like, you think you know it, but let's go through it. Type in the comments what normal sodium level is. Type it right now. We can go through it, all of us together. We gonna get through this review. You gonna pass, trust me. All right, type what the normal levels of sodium are in the comments. And then when you're done typing sodium, 135 to 145, correcto. Now let's go to chloride. What's chloride? Now chloride, off the top of my head, it doesn't go. Does it?
Yeah,
that's go for you?
Yeah, I don't remember chloride by heart.
I was like, sodium, 135 to 145.
Everybody's like 135, 145.
I was like, now what's chloride? I was waiting for it. Okay, y'all shutting me up. People was like, no, I know chloride, honey. It's 96 to 106. Get us together, okay? Get us together. Thank you very much. Now I know chloride levels. All right, so potassium, well, we already know potassium, 3.5 to 5. And then give me magnesium.
Is it 1.3 to 2.1? I feel like it is. Somewhere around that range.
What is mag?
I feel like it's 1. Yeah, okay, 1.3 to 2.2.
1.5 to 2.5. 1.2 to 2.2. And that's another thing, guys. Just in case you see like these different differentiating lab values, like you see like 1.2, 1.3, 1.5. Lab values will differ, and they will sometimes vary depending on the lab of whatever publication they're using. So I don't want you to, be getting yourself into a bind just because your book says 1.3 and my book says 1.5. On the NCLEX, it's going to be an answer that's like 8. It's going to be something that's not, when they're asking you about a value, saying, hey, is it normal? Is it high? Is it low? It's not going to be that small, that small area of, I guess, differentiation. It's not going to be like a 1.5 and a 1.3. It's going to be something to where this is an abnormal level. Okay, so just kind of be aware of that, just in case you see different lab values. Okay, as far as what values you should definitely go by, I'll go by what's in your book, whatever book that you're studying, because it's not like the lab values are incorrect. It's just what values that specific publication's lab got. So it's not like it's wrong. It's just that value for those labs. So if you're using a specific book that has specific lab values, I suggest just using the lab values in that book, especially if you're using questions from that book, because they're going to go based off of that lab value. Does that make sense? And when you're getting to, you know, the big stuff when it comes to preparing for like the NCLEX, just know that the small, you know, variations won't make a difference. Okay. All right. We said mag, right? All right, perfect. So now we all know the correct levels for sodium, chloride, potassium, and magnesium. So just in case we get another question and, you know, of another type of value, now we know what our regular values are. All right. So keep those notes with you. Now let's go into, is it me or you? I keep forgetting.
You. I just did.
This is me. Okay, so let's do, let's go back to it. Med search for 3. All right, guys. Oh, yeah. All right, this one's shorter, so we can read it together. Laboratory studies are performed for a client suspected to have iron deficiency anemia. The nurse reviews the laboratory results, knowing that which result indicates this type of anemia. Is it 1, elevated hemoglobin level, 2, a decreased reticulocyte count, 3, elevated red blood cell count, or 4, red blood cells that are microcytic and hypochromic? All right. Now, remember, our client is suspected to have iron deficiency anemia. The nurse is reviewing those lab results, knowing that which result will indicate this type of anemia. So we're looking for the lab result that's going to indicate iron deficiency anemia. What is it? Let's go. And it is red blood cells that are microcytic and hypochromic. All right. So in iron deficiency anemia, iron stores are depleted, resulting in a decreased supply of iron for the manufacture of hemoglobin in red blood cells. So results of a CBC, or a complete blood cell count, in clients that have iron deficiency anemia, it's going to show decreased hemoglobin levels, okay, and microcytic and hypochromic red blood cells. Does anybody know what those mean? No, I don't. So let's Google it.
Okay, no, I can talk about it.
Oh, you did? Oh.
Okay, so with this one, you know, there's several types of anemia, right? Sam, you're so funny. There are several types of anemia, but this one in particular, we're talking about our iron deficiency anemia. So, just like a side note, this is a lucky thing right here when it comes to iron deficiency, because it's the only one that has the microcytic hypochromia. So these red blood cells are really, really tiny, and they're like pale pink. These are the only ones that have them. And so that's why it would be number 4, microcytic, small red blood cells, and then hypochromic. They're just they lost their color. We know that hemoglobin kind of tells us if the patient is anemic or not. So when we're looking at those levels, we know that there's a hemoglobin level for men, and then there's one for women. But anytime it falls below 7, I believe, that's when they're considered anemic. Mm-hmm. So basically, to wrap it all up, you want to know the types of anemias, because each type will have the different color and the different size. Most of your sizes are going to be macrocytic, but for iron deficiency, this is the one that's going to be microcytic, and then hypochromic, which is the color of the cell, mm-hmm. if that makes sense.
It does. Okay, so chromic, like chrome, like color.
Yeah.
And hypo
is the size. So this is going to be a small red blood cell that is pale in color. So yeah, let's set your options. That way you can narrow it down, even if you don't know this one.
Mm-hmm.
So with number 1, we know that the hemoglobin level will not be elevated because this patient is anemic. So we're looking for low levels of hemoglobin. We know that hemoglobin is what, like, binds oxygen to the cell. It carries.
No. So no, I was going to say what if a decreased hemoglobin level is anemia, what's it called when you have an elevated hemoglobin level?
Is it pheochromocytemia or something like that?
Yeah.
Okay. I was like, I know it's one of them.
You wasn't supposed to answer, Celia. It was for them.
Oh my gosh, it was them. I'm sorry, y'all.
You graduated already.
I'm sorry.
She's still in student mode. But yeah, is it polycythemia vera or something like that?
Yeah, that can be.
But yeah, just so you know what the difference is. So Gigi says, does the high levels vary with age in this case?
You said what?
Gigi asked the question. She said, does the high levels vary with age in this case? High levels of what? High levels of yeah, I'm not sure what.
What, red blood cells?
Or reticulocytes? Oh, of hemoglobin. Does the high levels of hemoglobin vary with age in this case?
Not necessarily. I think maybe sometimes, like, older people can have lower levels, but not really.
Just because
we all aim for like that same level, regardless of what where they are when it comes to like the age span. Anytime it falls below 7 for any patient, that's an indication of anemia.
So age isn't a factor in whether or not like your blood cells decreasing.
Oh, do you mean iron deficiency or just in general? Iron deficiency, younger women are more prone to iron deficiency. But if you meant like red blood cells, like
do they lessen in time, like
with age? Not typically.
I guess does it vary
now,
with age?
It may be, I think, harder for older people to create more red blood cells, like if something were to happen. But if I'm not mistaken, I don't think that was just a major influence for like our hemoglobin.
Yeah, I didn't think so either. But yeah, I just wanted to double check with you just to make sure. But that was a good one because I damn sure don't know what a microcytic.
Yeah, they're so tiny. Make sure you know the types, like how your cells will look.
Right. I was like, hypochromic. Are we talking about like rims? What are we doing?
Anytime you see chrome, that's the color of the cell. And then acidic will tell you like the size. So you want to know like how they would look. There's like 4 or 5 different types of anemias. You want to go back and look them up and know like how it would look. But I want to say your iron deficiency is the only one that will have that. And you'll have your sickle cell anemia where they're literally shaped like little sickles. And I want to say that is microcytic as well.
Or so you didn't know what the shape of a sickle was.
I know.
What's another, like a frisbee?
They literally look like little sickles, and they're very painful. But
just use the word again.
You said what?
I said, what word can we use if we don't know what a sickle is? And you're just like, literally little sickles.
For real, not really. Little icicles that's just hanging. But definitely know the type of anemias. You will be questioned on that. Iron deficiency is definitely more prone in our teenagers, adolescent women. Make sure you know the interventions for your anemia. So with certain deficiencies like the iron deficiency, I want to say you can only get that injection with that. No, that's not that one. Which one is the one where they have like a decrease in parietal cells? There's the one where there's a decrease in parietal cells.
Is it the pernicious?
Yes.
Pernicious. where they um usually get it after they have like some type of abdominal surgery
Yeah,
that
those gastric cells. So
Mm-hmm.
with that, only like you
You
can
can only
only get
get
it with you can only get like an injection. With the iron deficiency, you can replace it with like supplements, foods and stuff like that, and of course like the iron injection, I believe. But definitely know like your types of anemias, how your cells will look, and how you would treat it as a nurse.
That's good. That is good. Okay. Now, that was a good one, guys. Ooh, we are just clearing the board.
Y'all are killing.
I know, right? Let's do another dosage. Oh, and this one isn't fill in the blank, so at least you get 4 answer choices for this one. All right, guys. All right, guys. So penicillin G procaine. All right, that's 1 million units IM. That's prescribed for a child with an infection. The medication label reads 1,200,000. I was trying to say 1,200,000 units per 2 milliliter. The nurse has determined that the dose prescribed is safe. The nurse administers how many milliliters per dose to the child? Let's go back again. There's a lot of units. All right. So penicillin G procaine. All right. That is being prescribed. The amount that's being prescribed is 1 million units. All right. The label that's available for this medication reads 1,200,000 units per 2 milliliters of this medication. All right, the nurse determined that the dose prescribed is safe, so we can go ahead and actually give this dose. But the nurse administers how many milliliters per dose to this child? So you guys know we got to do our desired over available times our volume. And let's look and see what that answer is. I'm getting all what is like 4s, but just setting this up in my mind. Oh, yeah. We have what is 4. So remember, the desired was 1 million over what was available, which was 1.2 million. And then that was multiplied by the volume, which was 2. So we have 1 million divided by 1.2 million times 2 milliliters. The units cancel out, and that's going to give you 1.7 milliliters per dose, which is number 4. And all y'all said number 4. Okay, listen. Get us together. Okay, don't get us together. Get NCLEX and Dosage Calculations together, because that's definitely what you guys are doing. So proud of you.
NCSBN together.
Okay, yes. All right, guys. That was amazing. Awesome job. Jay, this is all you.
Awesome. Let's see. I'm gonna go with mental health 200.
Mental health 200. All right.
The client is admitted to a medical nursing unit with a diagnosis of acute blindness after being involved in a hit-and-run accident. When diagnostic testing cannot identify any organic reason why this client cannot see, a mental health consult is prescribed. The nurse plans care based on which mental health condition? Psychosis, repression, conversion disorder, or dissociative disorder.
Ooh. Get in like 3s and 4s. 3s. Let's look and see. 3.
Awesome. A conversion disorder is the alteration or loss of a physical function that cannot be explained by any known pathophysiological mechanism. A conversion disorder is thought to be an expression of a psychological disorder, need, or conflict. I said disorder, psychological need or conflict. In this situation, the client witnessed an accident that was psychologically painful, that the client became blind. Psychosis is a state in which the person's mental capacity to recognize reality, communication, and relate to others is impaired, interfering with the person's ability to deal with life's demand. Sorry, y'all. Repression is a coping mechanism in which unacceptable feelings are kept out of awareness, and dissociative disorder is a disturbance or alteration in the normally integrative. Oh my gosh, y'all, I can't read today. Function, identity, memory, or consciousness. So, all in all, number 3 is the answer: conversion disorder.
Conversion disorder. When I think of conversion disorder, I guess when I learned it in school, for some reason I was just like, okay, I'm so confused. There's a loss or there's an alteration of a physical function that literally just came out of nowhere. Mm-hmm. And my teacher was like, yeah, well, not out of nowhere, but it's usually a result of some kind of psychological event that just causes physical symptoms. Yeah, like in the example used was the one about the accident and like the person being blind or witnessing an accident, not being a part of it, but just witnessing the accident, and then that person becoming blind because it was psychologically too painful. That kind of reminds me of how like empaths act as well.
That's a good comparison.
But yeah, that one was good. Let's go ahead and go to our, let's do Farm for 3. All right, guys. All right, so this is Fundamentals for 300. The nurse assesses a client's surgical incision for signs of infection. Which finding by the nurse would be interpreted as a normal finding at the surgical site? So 1, red hard skin, 2, serous drainage, 3, purulent drainage, or 4, warm, tender skin. Getting some like 3s and 2s. I'm actually getting a little bit of everything. Remember, we have a surgical incision that we're checking for signs of infection. So we have our normal findings, and then we have our findings that's going to be cause for concern. So right now, the question's asking us for normal findings, so findings that would not cause be reason for cause of concern. All right. Let's look and see what that answer is. And it is 2. Good job. All right, so yes, 2. Some people chose like 3s and 4s, but let's go ahead and go over it. All right, so 2, which was serous drainage. All right, serous drainage is an expected finding at a surgical site. All right, the other signs or the other options definitely indicate a wound infection. Red hard skin, purulent drainage, and warm tender skin around the incision. Those are all signs and symptoms of infection. Now, wound infection usually appears 3 to 6 days after the surgery. So the client may also experience like fevers and chills as well. And then the purulent material, that's basically pus, that exit and drains or separates from the wound edges. The infection may be caused by poor aseptic technique or just from contamination before surgical exploration of the wound. Now, existing client conditions such as diabetes mellitus or immunocompromised patients may place the client at an increased risk. So that has to be considered as well. 3, purulent drainage, that's not normal. That's indicative of infection. So serous drainage is a drainage that's normal because serous drainage is just specifically that is, let me tell you where to exactly it's made up of. It's the thin and clear. Yeah, it's the serous drainage. So it's the thin and clear drainage. Sometimes it'll have some blood mixed in with it, just based on how fresh the surgery is and if that's how fresh the wound is. But as long as the material is clear and not like a green color, not orange color, yellow color, and then that lets you know that's more so serous, clear drainage and not purulent or cloudy. Okay, that's what that that appearance of the purulent drainage comes from, just from the breakdown of those white blood cells.
Yes, and just a side note, you want to make sure you're watching out for like how much drainage is coming out. Always assessing your patient post-op because the patients are at an extremely high risk for infection, which can lead to sepsis, and it's not a good thing because that can lead to death. So always pay attention to the output, know what is normal and like what is just way too much in an hour or something like that. Because if they had like serous drainage and they had like say over like 100 in like an hour or something like that, then that will warrant you, you know. But serous drainage in general is common. That's what you want to see. That's the color that you want to see. But also make sure you take note of the output. Likely you'll see that on like your chest tube questions or something like that. And of course, like in the real world, you really want to pay attention to all of that stuff. Make sure you're going in that patient's room, you're assessing their site, you're looking at their dressing, see if it needs to be changed, if it's any active bleeding. Active bleeding is common, like post-op, like right after their surgery, but you want to see how much. So if you need to like change their dressing, definitely monitor and see if that next dressing is saturated within like the next 30 minutes to an hour, and then that would kind of warrant you to page your team and ask them like, is this okay? Is this what we're expecting? Some patients are bleeders and some are not. So just a little side note.
And also if you need extra help in trying to figure out if serous drainage or purulent drainage, which one's normal versus which one's not, how I remembered it was serous drainage is not serous. I don't know.
That's I love it. I love it. It's not
serious. I'm just like, okay, cool. Or serous drainage is only serious until it is. I don't know.
Yeah. But so you're looking for I just serious. And I think the serous as well. That one is okay too, just as long as it's not purulent or like,
exactly,
you know, green or anything nasty looking. That will warrant you for signs of an infection.
Exactly. All right, good one, guys. All right, now we have 5 left.
All right.
Oh, we have one in every category too. Now,
we do.
Now, which one do I want to do next? Okay, I'll do farm. All right. Ooh, word I can't pronounce. Propylthiouracil is prescribed for a client with hyperthyroidism. Okay, all right. The nurse provides instructions to the client regarding the medication and informs the client to notify the primary healthcare provider if which signs or symptoms occur. Is it 1, fever, 2, dry mouth, 3, drowsiness, or 4, increased urination? All right. Now let's go and look at what the question's asking us one more time. All right. We have this medication, PTU, is prescribed for a client with hyperthyroidism. Okay. Regarding this medication, which sign or symptom would we need to alert the primary care? Is it fever, dry mouth, drowsiness, or increased urination? Let's look and see what that answer is. What is 1? Fever. All right. An adverse effect of propylthiouracil, why can't I say that? Uracil is a granulocytosis. All right. The client needs to be informed of the early signs of this side effect, which include fever and sore throat. Drowsiness is an occasional side effect of the medication, and dry mouth and increased urination are unrelated to this medication. All right. So yes, 1 is the correct answer. So I wonder why we chose 2. Yes, and it says 2 says dry mouth, and it says dry mouth and increased urination are unrelated to this medication. Dry mouth, once again, go back to like classes. If you just in case I don't know what this medication is. But obviously it's being used to treat hyperthyroidism. So let's go and look and see. Oh, someone said thinking about sore throat. Okay, good. I just want to make sure that, because usually when people think of dry mouth, it's because they're thinking of like an anticholinergic. And so I just want to make sure you didn't think that this was an anticholinergic, because it's not. Swelling of neck. Oh, okay, gotcha. So yes, it is definitely the fever and sore throat and the granulocytosis. Someone says, what is a granulocytosis? So all right, so that is when you have an extremely low number of granulocytes, which is a type of white blood cell in the blood. It's very important as far as your immune system and helping your body fight infection. So when you have a granulocytosis, whenever you have that A, it means an absence of, or just a really low number of those specific types of white blood cells. Okay. All right, great job. So, all right, Jay, all on you.
Oh my gosh, we don't have that many options. Okay, so we go with fundamentals for 500. Yeah. So the nurse is preparing to administer an intramuscular injection to a 4-year-old child. The nurse plans to administer the injection in the ventral gluteal muscle, knowing that which indicates the maximum amount of medication volume that can be safely injected.
All right. The answer choice is 0.5 milliliters, 1.0 milliliters, 1.5 milliliters, or 2.0 milliliters. Everyone's pretty much answering. Everyone's saying what is 2, which is 1 milliliter. And it's actually what is 3, 1.5.
Honestly, I didn't know that one. I didn't.
I was like, did I?
I thought too.
Let's see. So it was 3. Okay. So go ahead and read it.
In a young child, ages 3 to 6 years, the maximum volume of medication that can be safely injected into the ventral gluteal muscle is 1.5 milliliters.
Is it because it's specifically the ventral gluteal muscle? Maybe. But yeah.
I know it has something to do with age, like whatever age they are.
Oh, yeah. 3 to 6.
But I honestly can't remember like the increments for it. I remembered it enough for the NCLEX, but I can't remember the exact increments. But I know like the lower they are, the less they get.
Yeah. Yeah, which makes sense because they have to make sure that their muscle mass can accompany that volume.
Yeah.
So that makes sense. But yeah, it was 3. I don't think anybody got that one right, but that's okay. Because what happens at practice, we all look ugly.
Things at practice, and y'all are still troopers. So that question had nothing on y'all.
Exactly. I always love comparing practice to Beyonce's homecoming because they was practicing for like a year. right? They was looking ugly in that mirror for a good 9 months, all right, before they started looking cute and really getting everything together. So I don't want you guys to get discouraged anytime you guys get a question wrong or anything like that. Just learn from it and take it in stride and learn it for next time. All right, so let's go ahead and do our med surg for 100. All right. The nurse is reviewing the laboratory results of a client diagnosed with multiple myeloma. Which would the nurse expect to note specifically in this disorder? Is it 1, increased calcium level, 2, increased white blood cells, 3, decreased blood urea nitrogen level, or 4, decreased number of plasma cells in the bone marrow? Judy says ATS says for infants 0.5, 1, and children up to 2. I think that was for us. Thank you, Gigi. All right, guys. We're trying to figure out the laboratory results for a client diagnosed with multiple myeloma. Which one would we expect to note specifically? Seeing lots of 4s, which is decreased number of plasma cells in the bone marrow. Let's go ahead and see if that is correct. And it's actually number 1. Wow, increased calcium level. Oh, wow. So it says findings indicative of multiple myeloma, which is a type of cancer, by the way, is an increased number of plasma cells in the bone marrow. Number 4 says decreased number of plasma cells. All right. It's also going to show anemia, high and hypercalcemia, which is increased calcium. And that's caused by the release of calcium from the deteriorating bone tissue. That's what I was thinking in my mind, to be honest. And actually an elevated blood urea nitrogen level. So that BUN level is actually going to be increased, not decreased. That increase of the white blood cell count may or may not be present, and that's not specifically related to multiple myeloma. So once again, that was a good one. It was actually hypercalcemia. So good job, Gigi. I think Gigi was the only one that got that one. Great job, Gigi. Yeah, I'm just looking through it and just to make sure that we are all in the same question. Okay, yep. All right, so that was a good one. That makes sense as far as the calcium levels being affected because of the release of the calcium from the breakdown of that bone tissue because of the increase of number of plasma cells in the bone marrow. So you see, it's just kind of like a piggyback. Someone says, why do the plasma cells increase? Great question. I don't know, look it up.
Increased number of cells. Let's see. I think it could be that you know how like the system is set up to where like
I got it.
Erythropoiesis, that could be the reason why there's an increase because it's telling the bone marrow to make more.
More, exactly.
Sensing low cells.
Pretty much.
So it's
as the number, as the number increases, like you said, they tell them to make more. So the number of those plasma.
Yeah, so that's why it's going up because it's sensing a decrease.
Right.
So it's going to tell the bone marrow to make more plasma cells.
Right. And
how erythro
works. And even with the bone tissue, it starts to deteriorate because that bone tissue only has a certain number of max capacity. And so if they have, that those plasma cells keep coming in there when the max capacity was at 300 and we round here at 350, then it's going to start to overflow, and that's going to start to deteriorate that bone tissue and leak that calcium into the blood, which will then have us increase that calcium level. Yeah, it's a critical thinking question. Exactly. All right. That was a good one. Was that mine?
Yes.
Which one do you want?
I guess I'll go with the dosage.
Good old Didge.
I have a
This
safe
number-
word letting you take these out. The primary health care provider prescribes digoxin at 0.25 milligrams orally daily for a client with heart failure. The medication label states 0.125 milligrams per tablet. The nurse should administer how many tablets to the client. Fill in the blank. So always know what you're looking for, what the question is asking for, tablets, and then based on that, you can set your problem up. I honestly don't have a scrap sheet of paper, but I don't know about y'all. I really love to see like the tablet questions because
I love those tablet questions.
Easy.
Right. When you were like, I don't have scrap paper, I was like, to be honest, you don't need it.
You can work it out in your head.
They was working it out before you even got to fill in the blank. Like, I think Gigi had already put 2 before you even got to the word tablet. Like, so let's go ahead and see what that answer is. Shocker.
What is
it's 2?
Tablet.
How in the world did you get that? So just like you said, I think everybody got 2 tablets. Yeah. Did you explain why already? You already said the desired over available?
Basically, I set mine up using dimensional analysis.
Yeah.
So to like find what the question is looking for and set it up like that. You will cross out your milligrams and then multiply across, then divide, and you'll end up with your 2.
Right. Yeah. That was chump change to you guys. Of course, you know, we're here doing critical thinking questions and they got asking about tablets, you know? All right.
That.
I was like, that was
drum
3.
roll.
All right, guys. Our last one. Just came across a word. I don't even know what that is. All right. Last question. Which behavior would the nurse anticipate a client diagnosed with nyctophobia to demonstrate? What's that? 1, declines an invitation to walk around the park. 2, never takes an elevator, but rather climbs the stairs. 3, always turns on the overhead light before entering a darkened room. 4, refuses to engage in conversations when in the presence of more than 2 to 3 people. I'm gonna say 3.
Let's see.
I say 3. I don't know what the hell nyctophobia is.
I don't think it's 3.
What do you think
what
it is?
What do you think it is? I don't know.
Let's bet. Oh my God, what do you think it is? I think it's 3. What do you think it is?
So it's not 2 for sure. Number 1 may have a social phobia or something.
That's what I thought number 4 was. I thought 4.
Or 4 maybe.
4 was social
okay, I'm gonna go with 3. I'm gonna go with 3. Never
okay,
mind.
okay. And then 1 is that when they have agoraphobia?
Agoraphobia.
I was thinking.
Agoraphobia. Sorry.
And then never take an elevator, but rather climbs. I don't even know what that is.
They're scared of heights. I'm having a brain fart, but
right. So I didn't know what it is. So this is us trying to, process of elimination. This is in real time, us trying to figure out what it is. Because
I feel like it's 3 for sure.
Me too.
That'd be 3.
All right, let's look.
Yay! It's a fear of darkness.
Look at us.
Okay.
All right. So nyctophobia is a fear of darkness. All right, did somebody say that?
What?
Area. Yeah, they said they have a fear of darkness or nighttime. But we didn't know that at the time. But now we do. All right. So nyctophobia is a fear of darkness. Okay. Social phobias are characterized by severe anxiety or fear provoked by exposure to a social situation or performance situation. So number 4 was definitely social phobia. Oh no, that was 1, I think. Yeah, I think 1 was social phobia. Fear of public speaking. That's actually the most common form of social phobia. So I think that's maybe like 4 in 1. Agoraphobia, I was right, is the fear of open spaces. So that's number 1. And then the claustrophobia, you're right, is the fear of closed spaces. So that would be, they would take the stairs rather than being an elevator. So yes, number 3 was always on the overhead light before entering a dark room. Nyctophobia. Also, I was thinking about like looking at the word. I was like, what the hell is NYCT? I was like, Nick. And then I started thinking about like nocturnal. Like I was like, close enough, sure.
Yeah, we know what phobia is, right?
All right. Okay, that was our last question, guys. So you have officially won and beat NCLEX Jeopardy. I'm so proud of you guys. Thank you guys for joining us all the way through. So excited. Now you guys will have this complete replay. It'll be mailed to you guys. It'll be emailed to you guys, I believe 8 o'clock in the morning. So make sure you check your emails, check your spams, and check your other like miscellaneous folders, like your promotions and updates if you have Gmail, just in case you get you missed that email, but it will be sent out tomorrow with that replay. Do you have anything to add, Jay?
We do have a pharmacology tutoring session coming up. Yeah, what were the dates for that?
November 12th. So we're gonna start with the November 12th one, and then the second date after that is going to be November 29th. But for right now, just the November 12th one is available for purchase. That's going to be $29. It's going to be our 2 to 3 hour review and the replay, of course, as well. Now, this is going to be on pharmacology. And because we know pharmacology is just so huge, it's actually going to be split into 2 parts. So this will actually be pharmacology part 1.
Yeah. So our goal was to really kind of tackle down on the high yield. That's what we're kind of focusing on, what NCLEX will test you on, what is like some of the most, difficult subjects in nursing school. I remember it being foreign for a lot of students, and we know that like finals are coming up, so you want to consider getting enrolled in that. Typically, we charge about $49 per tutoring session, so $29 for 2 hour session is like
and the replay for 3 months.
Yes, so make sure you sign up for that. You get enrolled and participate in the pharmacology review. That way you're not struggling to study for finals. Both Sam and I, we have great experience with tutoring nursing students. You know that, so you're getting a steal for sure.
Yes, and because you guys came and enjoyed NCLEX Jeopardy with us and spent your Thursday night with us, I want to give you guys a special discount code, TUTOR20. TUTOR 20. You get 20% off site-wide. All right. Someone said
that will be like the new generation. It won't be put into place until I want to say 2022, I believe.
Yeah, it was 2022, 2023. And I apologize, that Tutor 20 is going to be 20% off the next tutoring session. So the pharmacology one we were just talking about, when you guys sign up for that, it's originally $29, but go ahead and save another 20% by using code Tutor 20. So you guys can be there on the pharmacology tutor session on November 12th. Kind of just like this, where we just come in a group and we go over questions, and it's going to be run by Jay. All right. We're going to make
a lot of content, and we're going to go over questions and how to really answer those farm questions that you'll see on your finals and NCLEX, and really get into the nitty gritty things that you may have missed during your first semester of nursing, or right now, if you're in your first semester of nursing and you're struggling, we're going to really break down some of those topics, such as our cardiac drugs, respiratory. We're going to get into the GI and all of that stuff, and really understand why those drugs work the way that they do, and our considerations as a nurse when we're giving those meds to our patients. So we're going to learn all about our farm.
Now, as far as previous sessions and future sessions, I see Shannon K is asking for some mental health. That can be definitely, we're going to be doing a tutoring session on mental health coming up. We'll be placing votes on like which session should be next. We do have a mental health study kit. It's like Scooby-Doo themed. If you do want like a study kit sooner rather than later, you can go ahead and check that out as a part of the Ultimate Bundle. Or if you send me a DM, I can send you the actual just link to the actual study kit if you just want the mental health study kit. We had critical care slash like cardio, and we also had dosage calculations, and we had a fundamentals tutoring sessions. Those were the ones that we had previously. And then as far as ones that we will be doing in the future, of course, like I said, we will definitely do a mental health one, and we're gonna come to you guys and vote, have you guys vote on which topic should be next. So definitely be on the lookout for that. Make sure you follow both of us on social media and you're subscribed to our email list so you get all those changes and notices. This is there any PowerPoint for pharmacology tutor? There's gonna be a PowerPoint during the tutoring session.
The tutor 20, I put that in the chat box.
That is a good question though. Someone said, will we be repeating any, or will we just be reselling the replays? That's a good question.
I think for now we'll reselling the replays, but for sure within like the next month or so we'll start like repeating. I don't know. That's a good question.
So Terry said I don't see link for private tutoring. It's not private tutoring. It's for the group tutoring. It is actually. If you go to thenursesam.com.
And it's this link.
Yeah, it should be the tutoring link. Yeah, it's actually right under where it says, if you go onto the website, thenursesam.com, and hover over nursing school study kits, click tutoring, and it'll pop right up. Let me go ahead and give you guys the link just to make it easier. There you go. And once again, make sure you use code tutor20 to get 20% off. All right. And now as far as the critical care, the fundamentals, and the med-surg from the ones that we were doing, the ones that we did previously, if enough of you guys are interested in getting the replay version, let us know, and we'll try to work out something where we can give you guys access to the ability to purchase and access the previous tutoring sessions, so you guys don't have to wait on that as well. So if enough of you guys express interest in that, we'll definitely make that happen. Okay, but I think that's pretty much it. I'm so glad you guys came and joined us. This was so fun.
It was really fun.
Now, as far as these NCLEX Jeopardies, I typically like to do these once a week. Typically do them on Instagram Live, and we usually do it, like I said, on Instagram Live. It's typically not this full blue, screen production. We usually do this once a month, but if you download the Nurse Sam app, you can actually play the mobile version of this game every week. So we have new questions, new 25 questions every week, every Thursday, if you download the Nurse Sam app. Okay, it's free, the Nurse Sam app. Just go search it in your Google Play, your Apple, whatever's. Just search the Nurse Sam in your app store, and then when you hit NCLEX Prep, you'll be able to play the mobile version. So blue screen, just like this. And I'll actually have this specific. Actually, no, I take that back. No. Make sure you guys download the app so you can play a new set of 25 questions every Thursday. Okay. All right. Someone said, Kiosha, I just dropped a link right there as far as the tutoring. And go. All right. So that's all I have. Do you have anything, Jay?
I do not. If y'all have any questions, feel free to reach out to one of us. We will be more than happy to answer any questions you may have. If you're prepping for the NCLEX or your finals, or just want to get ahead of the game, we always have tutoring sessions available at least twice a month. And then study kits are always available for purchase. And then we also give free advice. So.
Right. And we do these weekly NCLEX Jeopardies, and sometimes I do it, not sometimes, but I also do it on Tuesdays as well, on the ATIT's entrance exam. We do those on Tuesdays, and we do these on Thursdays. So there's always some practice. There's always some fun studying to go around. So if you guys just want to, if you need a safe space to come and just answer some questions wrong without feeling judged and feeling overwhelmed and super anxious, come on over. All right, guys. Y'all have a great night. We're going to get some rest and get some content up for you guys. Okay. We're going to get this replay up for you guys. And thank you all so much. Jay, thank you. This was great. I had so much fun. We definitely have to do this again. All right, guys. I will see you next time, and be on the lookout for this replay.
Bye.
Bye.